Taxpayers foot the bill for welfare programs, and non-citizens are adding plenty to that cost. Stephen Camerata of the Center for Immigration Studies has just added up all the numbers.
We found that 63% of households headed by non-citizens had one or more people in that household using at least one welfare program.
That's almost double the rate of American-born citizens.
In terms of food programs or Medicaid, the share of immigrant households with somebody using it is about twice that of the native-born.
This is what happens when millions of low-wage, less educated immigrants flood the nation.
If you bring in low-wage workers, they, and very often their U.S.-born children, qualify for a host of programs. If you had to put it into a bumper sticker, it's that there's a high cost to cheap labor.
These folks are also 3 times as likely to be uninsured, causing Americans to bear much more cost.
Non-citizens in general and immigrants in general have very high rates of lacking insurance, usually double or triple that of the native-born. But what happens when someone shows up in an emergency room? They're going to get care. We're not going to not that, and it's going to come at taxpayer expense anyway.
Or at the expense of other sick people, who those hospitals will just hit with much higher bills to make up for those who got their care for free. Camerata points to the solution. Make an immigration system that mostly takes in more educated people who are more qualified to get the kind of jobs that will allow them to afford insurance and keep off welfare, so you don't have to foot the bill. Paul Strand, CBN News, Washington.